Anal cancer is one of the rarer types of intestinal cancer. It is associated with the human papillomavirus. Interestingly, the human papillomavirus is a very contagious virus that pre-vaccine had affected the vast majority of the population. There are certain types of the human papillomavirus that are carcinogenic, and what I mean by that is that by harbouring the virus, there is an increased risk of anal cancer. The way to think of anal cancer versus colon or rectal cancer is that anal cancer is more of a skin type cancer because it originates from different types of cells. And so with anal cancer, the perianal skin or the lining of the anus, the very bottom part of the intestine, is where the cancer arises. Now that's compared to, say, colon or rectal cancer, which arises from the bowel lining. Unfortunately, like colon and rectal cancer, patients can often have very few symptoms. However, if patients have symptoms, bleeding is a common one, the sensation of pain or fullness or discomfort over the anal canal, or discharge. Essentially, if you experience any symptoms, you should seek review so the area can be fully assessed. At St Vincent's Hospital, we see more cases of anal cancer and the precursor lesions than compared to all over Australia. Because of our local interest in the area, we've also developed new technologies in both the investigation and treatment of anal cancer, but also the population near St Vincent's that are at a high risk of anal cancer. Our transplant patient population, because of their immunosuppression, meaning that their immune system is lower, are at an increased risk of anal cancer. HIV positivity, men who have sex with men, cervical cancer or cervical lesions also all confer an increased risk. For the early lesions, either a local excision or either what we call radiofrequency ablation has been started at St Vincent Hospital. In this, we utilise radiofrequency ablation to clear any of those precursor cancer cells to prevent transition to invasive cancer. If patients have a confirmed cancer, then chemoradiotherapy is usually the mainstay of therapy. So at St Vincent's Hospital, all patients with an anal cancer are discussed at our multidisciplinary team meeting, where we review all the components of a patient's care. In excess of 70% of patients will obtain complete cure with chemoradiotherapy. Occasionally though, surgery is needed, and that's what we can go through when we see you during your consultation.